Purple Bag Syndrome. Welcome to our deep dive on Purple Bag Syndrome, a visually striking phenomenon that appears in patients receiving parenteral nutrition. In this scenario, the lipid emulsion component within the nutrition bag develops a vivid violet or purple hue, immediately drawing attention. It is important to clarify from the outset that Purple Bag Syndrome itself does not directly threaten the patient's physiology. Rather, it serves as a chemical signal indicating a significant underlying metabolic disturbance. The true concern lies not in the coloration of the bag, but in the patient's clinical condition that led to this reaction. Let us break down the pathophysiological process, tracing it from its origin all the way to the appearance of the purple color. The core pathophysiological trigger, abnormal tryptophan metabolism. Purple Bag Syndrome arises from a disruption in the normal metabolism of the amino acid tryptophan, which is present in the protein hydrolysates or the free amino acids within the parenteral nutrition solution. In healthy conditions, tryptophan follows several metabolic pathways. A minor pathway involves its conversion, with the help of gut flora and certain tissues, into indole. Indole is then transported to the liver, transformed into indoxyl sulfate, also known as indican, and eventually excreted through the urine. However, in cases of acute kidney injury, chronic renal failure, or severe systemic infection and inflammation, such as sepsis or a systemic inflammatory response, this minor pathway becomes the dominant route for tryptophan metabolism. The kidneys, when impaired, lose their ability to efficiently clear indoxyl sulfate from the body, leading to its accumulation within the circulation. Additionally, ongoing inflammation and the presence of pro-inflammatory cytokines further shift tryptophan metabolism toward the indole pathway and disrupt normal transporter functions. From metabolite accumulation to purple pigment, the chemical reaction, the buildup of indoxyl sulfate, is the crucial precursor in this process. The distinctive purple discoloration is not a result of an in-body reaction but rather occurs outside the body, within the parenteral nutrition bag. Here is how the transformation unfolds. Indoxyl sulfate and other related compounds accumulate in the patient's plasma. These substances can then diffuse across the semi-permeable membrane of the intravenous filter, or they may be present in the solution if a bag is compounded for a patient already exhibiting very high plasma levels. More commonly, indoxyl sulfate diffuses from the patient's bloodstream into the parenteral nutrition solution during its passage through the intravenous line or filter. Once inside the bag, the environment is primed for a chemical reaction. Parenteral nutrition solutions, particularly those with higher concentrations of amino acids, often have an alkaline pH above 8, which encourages oxidation. Although lipid emulsions contain antioxidants such as vitamin E, exposure to light, oxygen, or trace elements can generate reactive oxygen species. Sunlight, especially ultraviolet or strong fluorescent light, acts as a potent catalyst for these reactions. Under these conditions, alkaline pH, the presence of oxidants, and light exposure, indoxyl sulfate undergoes hydrolysis to form indoxyl. Two molecules of indoxyl then oxidize and combine to produce indigo blue, a classic blue dye. Additionally, some indoxyl can react with isoden, another oxidation product, forming indirubin, a red dye. The blending of blue indigo and red indirubin within the white lipid emulsion gives rise to the signature violet or purple coloration. Clinical significance and what it means for practice. Purple Bag Syndrome is best understood as a sentinel or canary in the coal mine. It acts as a visible marker for serious metabolic dysregulation involving tryptophan. The most common underlying causes include severe acute kidney injury, systemic inflammatory response or sepsis, chronic renal failure with acute decompensation, and bacterial overgrowth or infection that produces additional indole. When Purple Bag Syndrome is observed, the recommended course of action is to refrain from administering the discolored parenteral nutrition. While the pigments themselves are generally inert, the stability and sterility of the solution may be compromised. Immediate clinical evaluation of the patient is necessary, with emphasis on kidney function, infection markers, and metabolic acidosis. The syndrome typically resolves as the patient's underlying renal or septic issue improves. In summary, Purple Bag Syndrome is an extracorporeal chemical phenomenon that serves as an unmistakable biomarker for a severe metabolic crisis, most frequently involving impaired tryptophan metabolism due to renal failure or intense inflammation. Thank you for joining us for this exploration of Purple Bag Syndrome. If you appreciate our content, please like, share, and subscribe to our channel. This is the Everything Surgery Podcast, where we dissect the extraordinary.